How would you briefly describe your project to someone unfamiliar with what you do?
Our project that we are lovingly calling GRITS, which stands for Georgians Receiving Insightful Telenutrition Seminars, is being implemented across Georgia. We are piloting telenutrition, virtual nutrition education with registered dietitians to seniors. The first branch of our pilot project is with group education. So we created 12 monthly nutrition seminars, and we Zoom right into the senior centers. The other branch of our pilot project is to implement individual medical nutrition therapy, so individualized nutrition counseling that we're calling nutrition coaching, to seniors who are at highest nutrition risk.
What is the why behind your project?
The why behind our project is that we found that nutrition education across Georgia was inconsistent and it varied widely across the state. We had a lot of discussions with the state dietitian in the Georgia Division of Aging, and she was feeling the same thing. And so, so our stars aligned and we partnered on this project to really try to make nutrition education for seniors more consistent and accessible. A lot of Georgian seniors don't have access, especially in rural communities, don't have access to registered dietitians.
What has worked well for your project?
The things that have worked really well for our program are really partnering with the senior center directors and successfully getting the virtual nutrition education, the Zoom group education to the seniors. I think the senior center directors are really seeing that there's a need for nutrition education with their participants, and so they're excited to get nutrition education to them, and that it's consistent and it's fun and it's engaging.
What are some challenges your project faced?
I think sometimes the seniors forget what they signed up for. They were a little confused, but we're trying a multiple array of options and trying to get them connected to our dietitian and successfully have sessions. And the seniors that have attended are super engaged. They're excited to make changes and to have somebody that's listening to their nutrition concerns and helping them with their health and making improvements in their life.
How did you find appropriate partners/partner organizations?
Luckily, before we wrote this grant for this pilot project, we had a wonderful relationship with our state dietitian, and she's been our biggest advocate in helping getting this project off the ground. We cannot thank her enough for all of the hard work she's done, but she's been introducing us to the AAAs and the senior center directors and wellness coordinators across the state.
What funding sources have you utilized or will you utilize?
Our project, we're so grateful to have funding from the Association for Community Living to fund this project 100%.
How will this project be sustainable once your grant period is done?
We've already started working on a sustainability plan, working with the Division of Aging in Georgia and working with the senior center directors to help them see that this can be a long-term benefit for their senior centers and for their seniors directly. We are hoping to that they can utilize the Older American Act funding to help support the nutrition education, sort of by shuffling around their resources and utilizing us as a service provider for them.
What stakeholders do you need buy-in from?
The stakeholders that we needed buy-in from was definitely the Division of Aging Chief Dietitian. She has been such a big advocate for this project, and she assisted us in getting buy-in from the senior center directors and the AAAs across the state as well.
What advice do you have for trying to replicate a similar project?
To be flexible. What we found out is that the AAAs operate in a lot of different ways across the state, and so you have to work with those teams and really engage them in how they operate so that you could be a part of their team as well. And it's not easy when we're in Atlanta and they're all across the state. And so we're utilizing Zoom to have those meetings and those conversations and test all of our technology, so making sure that the senior centers have the capabilities, either a smart TV or projectors and screens, to be able to have Zoom right in their congregate sites.
How do I get started?
I think the first steps for creating a project like this is assessing technology and seeing what resources senior centers have and what seniors themselves have as well at home. And if you need to help out, I think make resources available to help those senior centers gain access. I think working with the senior center directors really closely also helped us to implement our curriculum.
What do you wish you would have known prior to beginning the project?
Working with a dietitian was really unfamiliar with them, and it just was a concept that they didn't quite grasp. So it's been awesome to see these seniors sort of be questionable about our intentions, but once they talk to us and see how awesome we are, that they've really enjoyed engaging with the dietitian and seeing how important it is to work with the dietitian to improve their health and their health outcomes.